Good morning, I am Dr. Ahmed Ragab, demonstrator of head and neck surgery. Today we are going to talk about surgical instruments. For identifying any surgical instrument, we should also know the criteria to identify it. Criteria like if there is a lock or there is no lock, we should inspect the blades and identify if there is a serrations running horizontal, running vertical, and so on, sort like that. First of all, I'm going to talk about this instrument, which is mastoid retractor. It's a type of non-retaining, self-retaining retractors. The idea of mastoid retractor, it allows you to retract the wound without the need of an assistant, and it allows you to a good exposure for a wound, and it is used in vascular surgeries. The second instrument, which is the sessile jewel retractor, it's also a type of self-retaining retractors. The idea also is to retract the wound to allow a good exposure, and it is used mainly in thyroidectomy operation. The third instrument here is the curette. The idea of the curette is that we are going to use it in curettage and debridement of dirty wounds and abscesses by its blade. This is also a curette. There is another instrument which is known as a towel clip. The idea of a towel clip or in any operation, we only expose the area you are going to make an incision in it. So the idea here is that other areas will be covered with towels to prevent hypothermia. It's the main aim is to prevent hypothermia and prevent infection. So we are going to hold towels together using the towel clip. The idea in this instrument is that it has a lock and it has a curved blade with a sharp ends. It has a lock, curved blade with sharp ends. This instrument is known as a scalpel handle. Its main aim is to hold the scalpel to make an incision. It's not applicable to use the scalpel by your hand and hold it to make an incision. There is a risk for injuring yourself or making the incision in not a proper way. So the main aim is of the scalpel handle is to hold the scalpel in a proper way. This instrument is known as sponge holding forceps. Sponge holding forceps. The main aim of the sponge holding forceps is to hold the sponge used in draping and disinfection, or used in disinfection of wounds. To identify this instrument, you will find here that there is a lock and there is a oval-shaped blade with a horizontal serrations for holding the sponge. So this instrument is known as sponge holding forceps, and its aim is to hold the sponge. This is the sponge holding forceps also. You can notice here the horizontal serrations and the presence of a lock. This is another sponge holding forceps without a serration, with an oval shape or ovoid shape blades, and it also has a lock for holding sponge. We notice here that this is a scissor, but it's known as a dissecting scissor. We used it for dissection in neck, in abdomen, and to identify this instrument, you will find that this is like a scissor with a curved blade and the blunt ends. This blunt end to prevent injury of any vital structures during dissection. So this instrument is a dissecting scissor. This is a forceps, okay, but we should notice that at its end there is a tooth. So it's a tooth forceps. The main aim of this instrument is for holding tough structure. You can notice here that at its end there is a tooth. for holding tough structure. So the name of this instrument is toothed forceps. This is another photo of a toothed forceps. Notice here that there are two teeth. This is another forceps, but if you notice at its end there is no tooth, so it's a non-toothed forceps. And the main aim of this instrument is to hold soft structure or delicate structure. This is another photo of non-toothed forceps. Notice here that the serration runs horizontal, so it's a non-toothed forceps. This another instrument, okay, we should know it well, and we should identify what is the criteria. First of all, there is a lock, and it has a blade which has a serrations in a horizontal manner. So its name is an artery, okay? Its name is an artery. So to identify the artery, you will find that there is a lock and the blade has a serrations in a horizontal manner. Arteries, there are different types of arteries. There is a straight artery and there is a curved artery. So here, this one is known as straight artery and this one is a curved artery. So what are the criteria to identify the curved artery? First, it has a lock, number one, and it has a curved blade and the serration runs horizontal. Like here, you can see that these are the serrations and it runs horizontal. Here it's a more clear photo for the serrations in a horizontal manner. This is another instrument which is known as Kocher's forceps. The idea of Kocher's forceps is that it's an instrument with a lock. You can notice the lock here. And it has long blades with a horizontal serrations. So you should write down the criteria to memorize it, that it's an instrument with a lock, number one. Number two, it has horizontal serrations and long blades. At its end, you can find a tooth. So it has a tooth at its end. So this instrument is known as Kocher's forceps. And we used it in appendectomy for we apply the Kocher forceps on the base of the appendix before removal it, okay? To prevent the spillage of fecal content in the bitumen. So the idea of this instrument or the criteria for identifying this instrument is the presence of a lock. It has long blades with horizontal serrations and it has at its end a tooth. So it's known as Kocher's forceps. This is another photo of Kocher's forceps. Here is a lock and it has long blade with horizontal serrations and at its end there are tooth. This instrument you will find here, there is a lock and there is a blade and its blade has a horizontal serrations, okay? But it is very short. It has a very short blade. And if we open the instrument, we will find a vertical groove. This vertical groove is used for holding the needle. So it's a needle holder. So for identifying this instrument, the criteria of it is the presence of a lock, number one. It has a very short blade where the serration runs horizontal, but you will find a vertical groove for holding the needle. This is another forceps which is known as ring forceps. Here you can find it has a lock, number one, and here you will find at its end there is an oval shaped or rounded shaped blades with a blunt ends. And the idea of ring forceps, it is used for holding the spermatic cord during herniectomy or hernioplasty. So this forceps is known as ring forceps. The idea of this instrument again, or the criteria of this instrument again, that it has a lock, number one. It has a rounded shape blade with blunt end and it is used for holding the spermatic cord. This instrument is known as an Alice forceps. The idea of the criteria of Alice forceps that it has a lock, number one, it has long blades with a claw-like ends. So the criteria of Alice is that it has a claw-like ends, it has long blade, and it has a lock. Alice is used in many operations. It is used for holding tough structures, and we can use it in holding piles in hemorrhoidectomy operation and so on. So this is an Alice. To identify it, you can find that it has a claw-like ends, it has long blades, and has a lock. This is another photo. It's an Alice forceps. You can find here there's a claw-like ends, long blades, and there is a lock. Another instrument I'm going to talk about it is a lance forceps. The idea of lance forceps, it has a lock and it has short blades with two fenestrations. Fenestrations, this is a fenestration, okay? It has two fenestrations and its end has a tooth like that. This instrument is used in hemorrhoidectomy operation also for holding the hemorrhoid and dissecting it for its removal, okay? So this instrument is known as lance forceps. It has a lock, it has two fenestrations and has a tooth at its end. Another instrument which is Babcock forceps. The criteria of Babcock forceps are the presence of a lock, it has long blades, and it has two fenestrations also, like that. Also, there are two fenestrations here, and there is no tooth. So, to compare between Babcock and lance, Babcock, it has a long blade, but lance forceps has a shorter blade. Both of them have fenestrations, but in Babcock there is no tooth, and both of them has a lock. Okay. For lance, it is used in hemorrhoidectomy operation. For Babcock, it is used in appendectomy for holding the appendix before its removal. Okay, and delivering the appendix from the wound. Also, we use a Babcock forceps. Mainly, it is used for holding soft structure or delicate structure. We can, in thyroidectomies, we can hold the thyroid loop using Babcock without its injury. This is a clamp, okay? It's an instrument which has a lock and has long blades, but here we can find that the blade is making a right angle with the vertical axis of the instrument. So it's known as right angle clamp. This is a right angle clamp. This is another clamp. It has a lock, it has long blade with horizontal serrations, but it has a curved end, not a right angle, but it's a curved end. It is known as splenectomy clamp, and the idea of the clamp is to crush the blood supply. In a splenectomy clamp, we crush with the splenic artery and take a ligature for splenectomy. Okay, so this instrument is known as splenectomy clamp. So there is a totally different from right angle clamp. Here, the blade makes a right angle with the vertical axis of the instrument. This is also another photo of a splenectomy clamp. Here you can identify there is a lock. It has a curved end and a horizontal serrations. This is another photo of a splenectomy clamp. You can notice here that there is a lock, there is a curved end, blades with horizontal serrations. This one is known as cholecystectomy clamp. So there is a right angle clamp and we can identify it easily. And there is a splenectomy clamp, and in between there is a cholecystectomy clamp. How can I identify this instrument? It has a lock and it has a curved blade. So why I didn't name it as splenectomy clamp? A splenectomy clamp, the blade has a more obtuse angle, more obtuse. than the cholecystectomy clamp here. So if you see a clamp making a right angle, so it's a right angle clamp. If you see a clamp with an obtuse angle, so it's a splenectomy clamp. And cholecystectomy clamp is in between. Okay, it's a 120 angle, by the way. Cholecystectomy clamp, so what is its function? The function of cholecystectomy clamp is to hold or to crush the cystic duct and cystic artery in cholecystectomy, in open cholecystectomy. Okay, so this one is known as cholecystectomy clamp. For identifying it, we will find a lock, we will find a curved blades with horizontal serrations, and its angle is 120 more or less. Yeah. What is this? It's a drain, okay? It's known as corrugated rubber drain. The idea of a drain, there are two types of drains. There is a closed drain and open drain. And this type is known as an open drain or corrugated rubber drain. The idea of this drain, we put it in a dependent site for allowing drainage of any collection. It can be used intra-abdominal, it can be used post in thyroidectomies. And the main advantage of this corrugated rubber drain, it's made of rubber and it's corrugated, so it's a corrugated rubber drain. The main advantage of this drain over other tube drains and Redivac, that it will not be obstructed by a blood clot or by a cellular debris or something like that. It will not be obstructed, and it allows draining of any collection in the neck or in the abdomen. For now, we finished instruments, surgical instruments. Thank you and have good luck. Have a nice day. Thank you.